Marianne wants to know how do you get off benzodiazepines or Klonopin? What are the class of drugs that Klonopin belongs to called benzodiazepines? Glad you asked, Marianne. She responded to a Facebook post I made, and she wants to know, I think she lives in North Florida. She wants to know how to get off Klonopin. She's been on it for many years, 20 plus years, and she wants to know how to get off. This is a class of drugs which, I hate to say it, Marion, but of all the drugs out there, this is the most difficult to come off of. Benzodiazepines are probably the hardest to come off of. It's the one where that receptor system doesn't seem to regenerate. It's the GABA system, it's called, and it doesn't seem to regenerate like if you were to come off alcohol, or you were to come off heroin or oxycodone or marijuana or cocaine or amphetamines. These drugs seem to be more difficult and leave people with problems. So what's the general rule here? What are some general rules here? The major drugs in this class are Klonopin, which is clonazepam, Ativan, which is lorazepam, Xanax, street name Xanax bar, otherwise known as alprazolam. Those are the three big ones. You can hear Librium used, which is chlorodiazepoxide, florazepam, which I think is Restoril, temazepam, estazolam is another one, and Prosom, I think. These drugs are all in the same class. They're all virtually the same thing. They're used for anxiety, they're used for seizures, they're used for sleep. The most commonly used one, I would say, is probably Klonopin. It's long-acting. The usual dose is 1 to 2 milligrams twice a day. Now, what's difficult about these drugs is, which makes it more difficult about coming off them, is the length of time you've been on them. So you've been on them more than a year. If, say, you've been on 5, 10, 20 years, coming off is more difficult. There's no question that dose and time are very critical here. So the higher the dose and the longer the period of time, the more difficult it is to come off them. For example, if someone was taking Xanax 1 milligram twice a day for a year, that's probably reasonable to come off of. But if they were taking 2 milligrams twice a day for 20 years, that might be very difficult to come off of. And what's the usual way that these drugs are detoxed? In my office, I usually set up a 2 to 3 month detox. It usually involves switching to a longer acting benzodiazepine, maybe using Librium, maybe using Klonopin, adding a drug that blocks the body's withdrawal symptoms like clonidine. What also could be used, I've seen helpful, is to put them on an anti-seizure like Depakote. Neurontin may be added. It's an anti-seizure which may calm the body's response to withdrawal. You may have to use certain drugs for sleep because these individuals, when they're detoxing, they don't sleep. Seroquel can be used. What also happens with these people, they develop tremors, anxiety, insomnia, and they feel a sense of restlessness. They can't sit still. Those are the main withdrawal side effects, and it could be very unsettling. It's very difficult for people to function, to think clearly, to sleep clearly, to eat. They feel like they're losing their mind. They can't, their thoughts are clouded, they become disorganized. It is very difficult. And of course, the longer that you've been on it and the more you've been on, the more difficult, the more severe these symptoms are. I usually set people up with a host of drugs to prevent tremor, to prevent anxiety, to prevent sleep problems, to prevent that longing, that craving for the benzodiazepine. What I also do is transcranial magnetic stimulation, which seems to offer some relief for people. It's putting these electrodes on people and on their forehead and behind their ears, and I think it's 40 minutes per session. It seems to calm the nerves and make the withdrawal go better. And I keep them on the machine for like a month every day. I slowly taper the benzodiazepines, and I give them my cell phone, and I slowly taper the drug, switch to a long-acting form of the benzodiazepine, and slowly taper it down. Could take months. It's very difficult. People can get depressed, psychotic, seize, tremors, problems concentrating, problems sleeping, problems appetite. It is very difficult. They have my sympathies. It's a very difficult thing to do. Now, long term, if you left someone on, there are studies that say you predispose them to dementia, you can have memory problems, and you can have concentration problems, because there's something that develops with long-term use of these drugs, benzodiazepines like Klonopin, Ativan, and Xanax. Tolerance. You need more and more of the drug to do the same thing. So what does that mean? Well, let's say you're taking 1 milligram twice a day. You could actually go into withdrawal on that amount of drug after being on it a year or two, where you start getting interdose anxiety and feeling restless, and you're saying, I need more, it's wearing off. It's not wearing off, your body's metabolizing it quicker, and you develop a tolerance. And over time, your dose goes up because of the tolerance effects. So as you get older, you need more and more of the medication. I have some patients on 4 milligrams 4 times a day of Klonopin. Well, they've been on it 25 years, and I can't get them off, and they keep going into withdrawal. So it's like a vicious cycle. Yeah, but here's the problem. Although that individual doesn't appear sedated or drugged in any way, it has effects on cognition, memory, concentration, mental dexterity. So you're in like this vicious cycle of needing more of the drug just to remain normal, but more of the drug is causing these severe cognitive side effects. And that's why people want to come off. Not to mention long-term use of these drugs may, in fact, predispose you to memory disorders and cognitive disorders, i.e. dementia like Alzheimer's. Another problem with these drugs, it's easy to overdose on them. Not on the drugs themselves like Klonopin, Ativan, and Xanax, but when mixed with alcohol, this is a lethal combination. It is probably one of the more common successful suicide attempts in my office is mixing Xanax with alcohol or mixing Klonopin with alcohol. So you got to be very careful of that. What else can happen? One drug which is notorious for this is Xanax, alprazolam, also called Xanny bars. If you stop it suddenly, you have grand mal seizures. They can all cause grand mal seizures, but the one drug most associated with grand mal seizures is Xanax. So I talk more about addiction to Xanax, Klonopin, and Ativan in my book, Tales from the Couch, on Amazon.com, also on Lulu.com. You could also buy it at my office at 561-842-9550. So Marion, I hope I helped you with this video. And if you need any more help, just contact me on Facebook again. Bye.